being empathetic is very, very important, which we all lack nowadays. We take patients for granted, which may lead to uh, aggression, unhappiness
Yes.
between patient and doctor
Yes.
relationship.
Yes. So, as you said rightly, and we were discussing about communication being proper, it so happens that patients and family, typically in my experience, focuses only on the good part.
Right.
They don't want to dwell
Here,
much, or they don't want to pay attention to the negatives of whatever you're counseling, the negatives of the treatment. So they will tend to forget it. So whenever they come up for follow-ups, you should be able to talk to them, subtly indicate that we have to watch out. Say for in my case, we have to watch out for local recurrence, we have to watch out for pulmonary metastasis, reiterate the fact that they have been told about this so that they don't forget. In a few cases, I had to show them that this was written in their consent
right.
and they have signed it, that this
So
particular
written
points.
documentation is very important.
Absolutely. My consent for a limb salvage surgery runs in 4 pages.
I see.
And each and every one of those pages is being signed by a patient if he's an adult and their 2 relatives, along with me or my assistant as a witness.
I see.
And everything is explained in very clear terms to them. Okay, so that they should not feel that some things were not explained to them, something is new.
Right.
That should not happen.
Okay.
See, all said and done, our society is not yet that mature to accept the negative outcomes when we are treating them. There is somewhere, because of this consumerism, the feeling or the attitude is that we are paying for a service, so you are doing a service to us, and so you are answerable to the outcomes, and we want only perfectly 100% good outcomes.
Right.
That is the kind of expectation, and to get their expectation level to as close to the reality is what you need to, or we as doctors need to achieve.
Right.
It's because of the difference between their expectations and the reality that most of the unhappiness takes root from.
Do you anytime feel that sometimes we listen to hospitals getting broken glasses, OPDs?
Yes.
Is it mainly maybe one of the reasons could be because of lack of communication?
Yes, most of the times it's one of the major reasons. And somehow now, I did not understand this in the early years of my practice, but now we have to put ourselves into their shoes, and we have to think that what would be our reaction if the same thing would have happened to our relative, with we being non-medicos. Right. And then we need to talk to them. Most of the times my experience is that if you are very honest with them, even if it's your mistake, and if you say that, okay, this was not supposed to happen, but this happened, I'm sorry about it, most of the times our Indian society is generous enough, kind enough to just accept it. But it has to be told to them, and we have to come out as the honest party.
Right.
Not as someone who are trying to hide facts from them,
Right.
or not trying to tell them something. Of course, unfortunately in India, because the entire medical system, most of the super specialty care is being handled by the private sector.
Right.
And the government sector, barring a few reputed institutes nationally, most of the government institutes are unable to cater to a very super specialty kind of a care, except there are honorable exceptions to this particular thing. So that's the reason why the patient, and insurance cover being very low, the patient may be selling their land, mortgaging their houses for treatment of their near and dear ones, and we have to somewhere keep this in mind.
Right.
That they might have taken a lot of trouble, or they might have sold off everything, for this particular treatment, and wherein you are not being able to give them 100% guarantee or a result, 100% result. So somewhere we have to think about it.
Yeah. So whenever the disease is something which is not guaranteed, I mean the result is not guaranteed, can be expensive.
Yes.
The only way is to get trust of the patient and comfort them.
Absolutely. And I just said to a patient the other day, this week itself, that you seem to be not having that kind of a trust in me. And it's very important for any branch of medicine for the patient to have trust or have faith in the doctor. So for some reason, for their own personal experiences, maybe they have this kind of questions in mind, whether what I am being told is the right thing or not, whether I am being taken for a ride, or whether the doctor, whatever he's speaking is the right thing or not. And they try to question your decisions. I try to be as cool as possible unless and until this starts getting repeated. Then at some point of time, if the same thing gets repeated 3 or 4 times, then I tell the patient and the relatives that, look, okay, I have tried to explain things to you in the way they are. Unfortunately, you don't seem to be having, or you seem to be having a few concerns about my advice. So it's better that you have another advice
Right.
from someone more experienced, someone senior than me in this particular field. So that is what I normally do.
The sad part is that doctors are never supposed to be angry.
Yes,
We
but
are not supposed to vent our emotions.
yes, but doctors are humans.
Yeah, so
So
that patients should understand that
correct.
uh, when we repeatedly try to explain to them,
Yes.
this can happen,
Yes.
and many are influenced by Dr. Google.
Absolutely.
So
Absolutely.
they are brainwashed or they are
Yes.
overread,
Yes.
and that can also hamper our practice,
Yes.
our mental state.
Absolutely.
So
Absolutely. So, I was in Italy for my fellowship, and my mentor over there told this about Professor Mercury. He told this story to me. His mentor was Professor Mario Campanacci, who's a very big name
yes,
in orthopedic oncology. And he said that one of the patients was picking professor's brains about a particular advice that he had given, and he was telling Professor Campanacci that, oh, no, but I have my trust in God,
right.
and that everything will be fine and nothing will happen, or a particular thing will happen in a particular fashion. And so Professor Campanacci at that particular time coolly told him, but I am going to operate on you, not God.
Right.
So, so
Right.
all said and done, we need to be maintaining our cool. Sometimes we may lose our cool. Uh, Most of the patients would understand, since doctors are also humans. But as far as possible, it's always a good thing to keep our cool.
So the easiest way to keep a patient calm would be referring to someone else for a better or a different opinion.
Yes, the easiest way is to letting him know that
Right.
you have tried your best,
Right.
you are trying your best, and you are wishing the best for the patient.
Right.
That is the easiest way to make them or convince them that you are on their side.
Okay.
You are not against them as
Right.
such.
Right.
A lot of times, the economics may also be playing a role in this.
Right.
And sometimes we may have to, part with our fees or whatever for the benefit of the patient.
I'm sure
That-
you must have.
Yeah, we do it a lot. I mean, we do a lot of charity work for our patients right from the beginning, not because of some complication that has happened.
Right.
But then they realize that, okay, this particular person is trying to help us. So usually the problems don't arise from there.
You mentioned going to Italy
Yeah.
for your specialization. Uh, did you ever think of maybe settling abroad for better work-life balance, better remuneration? Anytime did it cross your
The
mind?
only thing I was sure about after my MBBS or my MS was that I'm not going to settle abroad.
Very
So yeah, but when I finished my fellowship in Tata Memorial Hospital, and I went to the director of Dinanath Mangeshkar Hospital, who's also an ex Tata fellow, Dr. Kelkar.
good. I see.
He told me, no, but I would like you to go abroad. That will broaden your horizons. You will get to see different centers. So I told him, I have seen everything that I need to see in Tata. Not the other things, probably what the Western centers do is not something that we will be able to do in our centers because of the costs involved. So that is not the question. But he said, no, it broadens your horizons. You get to meet a lot of people. You get to see what the premier institutes are doing and where you should be aiming to reach,
Right.
in which direction the field is proceeding or moving ahead. And that really helped me. So I just did some short fellowships, one in UK and one in Italy. And I came back and I started my practice.
There is this trend among once you finish any post graduation, go abroad. One, to have one on your CV that I have gone
Yes,
there, so that
yes.
once you come back to India, you get a better post. But do you really learn something from there? Maybe, maybe not. So how does one resident or a postgraduate choose or to go to a particular center? Is it the volume of work? Is it the name of the institute or
Yes.
the mentor? Which is
Everything matters. the name of the institute is because of the volume, is because of the mentors there, and it's again because of the institute and the mentors that they have the volumes. So you need to choose an institute that of your particular liking, where you would like to spend time. I was very clear. I knew that for a short duration fellowships, I wouldn't be getting hands-on
Right.
experience. That was not what I was looking at, but I was looking at what different things they do. What different approaches they have. How do they approach a particular case? So that is something. For example, from Rizzoli, I learned they have a fantastic records department.
I see.
And one of the topics that was given to me was to study the long-term outcomes in osteosarcoma patients, where the osteosarcoma has arisen in retinoblastoma survivors.
Oh,
So patients in their childhood who had retinoblastomas, who survived,
right.
then in their late teens they would probably are more likely to get osteosarcomas. And what's the long-term outcome of the treatment of these osteosarcomas is what I actually worked on.
Oh,
One of the topics.
I see.
And they had a fantastic records department where I could pull out the files from years back.
Right.
So that was one thing, how they maintain their records, how do they do research, their system of public health care.
Right.
So their patient's GP has answers to everything. So if the consultant has any query of the latest follow-up of that particular patient, would just pick up the phone, talk to the GP, and he would have the latest follow-up.
Okay. So when does a postgraduate go abroad? For a fellowship, is it immediately once he finishes his post-graduation and he has a feeling that I may want to join Ortho-Onco, or work for a particular time, then upgrade his knowledge going abroad?
See, I always feel that getting a basic postgraduate degree is just the beginning. No matter where you have been trained, a government institute or a private institute, once you get your degree, that's when actually your learning starts.
Right.
That is what I believe in. And you still need to do a few more things. You need to still do a few more things which you have not worked in a particular department for. Let it be spine, let it be arthroscopy, sports medicine, let it be joint replacement, whatever it is, shoulder. So one needs to have overall general knowledge of what's happening in all the branches. Of course, basic trauma is already there. So unless and until one is confident enough of handling basic fixations or complicated fixations, one should not rather move into a super specialized branch.
Right.
Have a general average level of competency in all the branches, then move on to whichever field of super specialization you want to.
Okay. And go abroad after their little bit hands-on in their.
Well, that depends.
Okay.
If your idea is to get settled abroad, probably you're not going to come back to India, then move out as early as possible.
Right.
But then if you want to set up a practice in India, don't spend a lot of time abroad.
Right.
Spend 4 years, 5 years, whatever's minimum required for you to pick up the knowledge and the expertise in various branches over there, and then come back as early as possible, because our practice is different.
Right.
Our practice is mainly eminence based. People, the day you start your practice is your day zero. People are going to start knowing you from that day zero, and you build up practice from there. So the later you come in, the more time you spend in getting established.
Right.
So earlier you come in, the earlier you get established.
So would you suggest that going intermittently for short fellowships would be ideal?
Well, I would suggest that
Once if you have gained a decent amount of experience from Indian hospitals like Tata and all those hospitals, and after that going for intermittent fellowships.
See, intermittent fellowships becomes a problem later on. After you start getting busier in practice,
Right.
it becomes a problem.
Okay.
I did that. I had a little while of private practice in between my 2 fellowships. But then leaving the patients again for 3 months and leaving your practice here altogether, that doesn't sound very well with your referring colleagues.
Right.
They should not feel, your patients and your colleagues should not feel that you are sometimes available, sometimes you are not available. Now we don't know next time when he's going to be traveling. That should not be the case.
You should be available for your patients.
Yes. So intermittent fellowships after a certain duration in your early practice doesn't make sense according to me.
Okay.
Then you should be going for very ultra short durations, like maybe a week only or so, maybe couple it with a conference.
Right.
And then go for a week or 10 days, and that's about it. So that is acceptable. Couple of weeks break has not harmed anyone.
Okay.
In fact, later on in the practice, it's always better to take breaks. So for the first 12 years of my practice, I did not move anywhere. I focused. I had little work that was also playing on my mind, how to build up my practice. I desperately wanted to do medium and high altitude trekking in Himalayas. But I was saying that how can I take a leave for 2 weeks, 3 weeks? And I was always in that frame of mind of not going or not taking a break for a couple of weeks or 3 weeks in a row. And then I started thinking to myself, if after 12 years, this is the same thing that I'm going to be thinking about every year, I'll never be able to do things which I've always dreamt of doing. And that's when after 12 years of my practice, I decided, oh, enough is enough. I want to do trekking in the Himalayas, and I'm going this year. And I took my first 3 weeks break in that particular year.
So now you were just mentioning something about your Himalayan trek. Was it out of sheer passion? Was it a way of escapism from your saturated practice? What made you start or choose something as high, as difficult as a high altitude trekking?
No, as a school kid, I was into trekking.
Okay.
Then during my professional college days, apart from a little bit of activity in the college, we couldn't do much. I was doing a bit of dramatics. I was doing a bit of trekking at that particular time, but that was all in the Sahyadris, in the Western Ghats. And I always wanted to visit the Himalayas, and I felt that I'm not able to find the time. And then I realized that okay, I have to make time for myself or for my hobbies. Another thing that happened was that over the years, my physical activity had got stagnated. I was not paying attention to my eating. Of course, the stresses were there. There were liabilities of early practice and early family life, and that also bothered me. And all of that, it all takes a toll. And then I had put on a lot of weight. There were certain health issues also. And then I realized that I had to do something. As I was crossing 40, I had to do something about it. Otherwise, I would be, not going to be enjoying life in the later years,
Right.
just focusing on my practice in the earlier years. So then I said, I have to make time. And that's when I started focusing more on my health, more on the physical activities, got my weight in control, started doing trekking to begin with, then moved on to cycling, then started running, doing marathons, and we have now progressed towards doing mountain ultra marathons and Ironmans.
I see.
Yeah.
So which was your last Ironman?
Oh, this was in June this year.
I see.
It was at Austria where I did a full Ironman.
Oh, excellent. What is that thing, or what is that adrenaline rush you have got after marathon, or how has that helped you change your practice? Has it calmed you down? Has it made you a better
Absolutely.
patient person?
Absolutely. Because, those endorphins help a lot. That sense of achieving something that you always wanted to achieve helps a lot. The breaks that you take, go to the mountains or do something, that always, takes away your focus from your patients, allows you to rethink your strategies, reset your goals, and makes you want to do more and more, both in your private practice and for your own self as well.
So from this 20 years of practice, what would you define a successful practitioner?
20 years actually is not sufficient or good enough, especially in a niche field, to define success. Success, I think it's different from person to person. For some people, maybe earning a lot of money is success. For some people, driving a big car or a very expensive car is success. For some people, owning a big house is success. For some people, having a big name amongst your peers is success. For some people, a lot of publications is success.
Right.
It all depends on how you define success.
Okay.
And you have to find your why.
Right.
You have to find your own definition of success.
Right. But do you feel that now, since you have a balance of a decent practice, decent health conditions, decent extracurricular activities like marathons and trekking,
Yeah.
do you feel contented? Are you happy?
Yes, absolutely. One thing is that I'll be very honest and frank in saying that your basic needs need to be satisfied for any doctor. Your basic needs, your basic income has to be taken care of. After that happens, only then, unfortunately, because we are not salaried people, most of us are not salaried, we are self-employed. So after a certain level only you can start thinking of your extracurriculars or things that you always wanted to do. But it's all about not finding time to making time. That jump everyone has to take for himself or herself. That's an important step to be taken. Now I can focus after 18 years of my private practice. I can say that I'm having an adequately good balance between my practice and my extracurricular activities. My patients know this.
Right.
They allow me to take a few days off, maybe a week or 10 days off. They wait for me sometimes. They do understand that I need to have my own time off, so they are also understanding. I also get recharged after these particular breaks, and I'm in a much better mental and physical condition to attend to them.
Right.
Not at all stressed always. My adrenaline levels, my cortisol levels are not high always. You feel the difference while working also.
Even when you're doing a challenging case in the
Absolutely.
theater.
Absolutely. It might be coming with practice as well over the years.
Right.
But I do believe that all these extracurricular activities also contribute towards that.
Do you feel generally our doctor population, are they healthy?
Most of them are not.
Right.
Most of them are not. Most of them are not paying attention to their own bodies, their own physical well-being, mental well-being. And at least in the first initial few years of practice, most of them are very highly stressed. So we need to do something about it.
I think this topic is not being talked about. I mean,
No, it
we
isn't.
hear about mental health in celebrities. We hear about mental health in business people, but no one really cares about what is our mental health.
Absolutely. Doctor is supposed to be in the best of his health always. That is what people think. That is not the case.
But I think the struggle of establishing a practice, maintaining your practice, then among your peers to say that, yes, I have a decent practice, all this creates some amount of tension, fear, and a lot of mental pressure.
Absolutely.
So I think, as you mentioned, a lot of going into some form of extracurricular activity will help you rejuvenate yourself.
Yes, absolutely. It's a must. You need to have a hobby which will help you in focusing somewhere else, channelizing. A sport, maybe it can be anything. It can be playing a musical instrument.
Right.
It can be singing. It can be a sport. It can be a frequent travel to a place of your choice. It can be anything. It can be photography.
Right.
At my hospital, having a hobby is promoted. It's considered to be a good thing.
Okay.
And if you're doing something else apart from the practice, it's considered to be a good thing. And these particular individuals are always kind of supported.
I think every hospital
and celebrated.
I think every hospital should follow that policy.
Absolutely.
Everyone is only focusing on who has the biggest OPD.
Correct. So every year in our consultants meeting, a particular individual has accomplished something different, has done something different. It's celebrated.
Right.
It's shared with everyone.
Right.
So everyone wants to do something similar. Everyone wants to do something different.
Right. What is your opinion about the current emergence of artificial intelligence in your field? Do you think will it hamper? Will it take over in time? Any idea?
No, we are still a very long distance away from that, or long. It's still a long time to go for that. It's in very primitive infantile stage, I would say. And no matter what, the kind of AI that we are talking about right now, there's always a human brain or a human hand behind whatever's happening. So we are hearing about robotic surgeries. There is a human sitting at the console, making the work, making the robot do the work that he's doing. So there's always a human element involved.
But general public feel the robot is doing.
No, it's not the case, obviously. So that's what I've been trying to do, and inform people, or educate them rather, that there's always a human hand behind the machine, behind the console, which is not shown.
Right.
That is still doing the things. So we are still a long way from a robo indigenously or independently operating on a person. We are not there yet.
Right.
We are a long distance away from that.
So we are almost coming to an end of our podcast.
Yeah.
So what would be few pointers you would advise an orthopedic resident to choose ortho-onco as a future profession?
Well, I would say that one thing is that you have to like that particular branch because you are going to practice it throughout your life. It needs to be something, and for any branch, not just orthopedic oncosurgery, any branch that you take up has to be such that you will not be tired of practicing it lifelong. In fact, you should be wanting to do more and more of it. Secondly, get trained well in the branch that you want to practice. Get trained well. You should not be, lacking any skills or any knowledge in that particular field. Thirdly, there is no need to take any shortcuts of any sorts. There's no need to compromise on your principles. Everything can be achieved. We can be very well successful without resorting to any kind of shortcuts. So have a very clean practice. You will be able to sleep very well in the night. Have a very good communication line open with your patients and their relatives. Ultimately that's all that is going to help and work.
Written and oral.
Written and oral both. More oral than written,
Right.
I would say. Written is important because after all, legally that is the only thing that is considered valid, not an oral consent. So have a very good communication skill, develop those particular soft skills. Be kind, be empathetic towards your patient, be sympathetic towards your patients. Try to help them as much as possible. Your honesty should reflect in your behavior and your work. And have and inculcate some hobby and pursue it
Right.
for yourself and your
And
family.
Yeah, give time to your patients as well as your family.
Family, absolutely.
Right, because ultimately it's the family who is going to
Yes.
support you in your
Yes.
older age.
Yes.
Yeah.
Absolutely.
So anyway, thank you, Dr. Yogesh, for your time.
Thank you.
It's been a pleasure and an honor listening to you. So thank you once again for coming.
Thank you very much.
And we hope you have a good time in Kerala.
Thank you. Thanks a lot, Vivek.
Okay.
It was a pleasure.
Yeah, thank you.